OBGYN went in and she tried to see if Mason was head down and ready for birth, and he kept contracting at the time, so she couldn't tell. So she said, let's just do a quick routine ultrasound. And when we did that, she noticed that there was some mass in Mason's brain. So we didn't know what it was, so they immediately sent me to a specialist. The specialist saw me, did the ultrasound, a more comprehensive ultrasound, and said that what they could tell was that they believed Mason had had a prenatal stroke, and that because of it, his brainstem was gone. So because of that, he would no longer be able to sustain his life when he was born.
I think both me and my wife were just completely caught off guard. Really didn't know what to think at the time.
We decided, when we had come to terms as much as we could, that we were going to lose Mason. There were a few things that we had decided were that we would have a priest present to baptize him, and that we would have an organ donation team there.
He was, laying on the table, they were cleaning him up, and he was still, crying and, looking normal and healthy.
He was born on a Monday, and by Friday we were hearing all kinds of things. We were told he'd be institutionalized. I had social workers coming in to meet with me to deal with the issue of raising a special needs child. It was just a kind of a whirlwind.
I went to see Mason because it was an incredible story that they were telling me that they had set up to really harvest this child's organs because they thought there was no brain there. And in my experience, that is almost never the case. That when large parts of the brain are not formed and we have a normal child there, it could be because there's a very large cyst there.
Thank God Dr. Sun made the house call. He brought, some great news to us.
Dr. Sun came in that day. He walked into my room, put the x-ray on the light box and said, look, he has an arachnoid cyst. Like I said, this is the protocol I think we should follow. There was a few things that could happen. Either the arachnoid cyst could go away on its own, or they would possibly have to go in and do surgery to remove it. The hardest part was turning him over for the surgery. That was probably the most helpless you feel as a parent, because it's not a simple thing. It was a brain surgery that would take 9 hours, and you never really know what's going to happen.
Mason had an enormous cyst which covered most of the skull, but once that was drained and treated, the rest of his brain, developed in a remarkable way, and he's essentially normal.
Seeing Mason for the first time after the operation, it's tough to see. But the whole time, it's it's for the best, and you're trying to keep a positive outlook on the outcome.
If you want somebody to look out for your son or your daughter who might be sick in a way medically that you cannot do, then Dr. Sun and Sue were our choice. The respect that Dr. Sun has for his patients, for his little babies and his little kids and his, teenagers, it's incredible. It's very subtle, but it's very powerful, and it's consistent throughout his care. His number one priority is for the kids that he helps.
I couldn't ask for a better son. It's already been 8 years, but it's only been 8 years, and I can tell, that he's got a quality personality, and he's happy, he's fun, he's always the first one up in the morning, ready to go.
He's phenomenal. He is everything that Dr. Sun knew he would be at 2.5 months old, or when he first met him at a week old.